We want to welcome on this episode of Talking Addiction and Recovery podcast, Tom Karl. Thanks for joining.
Thanks, Andrew. Thanks for having me.
Yeah, and it's great to see you. I know for listeners, they might not be aware. You and I, we know each other. We've run into each other, I think, on different parts of the country here at different places. We're going to
We
talk a little bit
have.
more about how that is, and it's great to have you on. Before we dive more into that, can you just give listeners a little bit of a background about yourself?
Yeah, so I'm Tom Karl. Professionally, I'm the founder of R1. I'm the CEO of R1. For a while there, it was Tom and on his recovery journey trying to figure out his service project, and that became a company called R1 Learning. So my background, just Andrew, and you and I've talked a little bit about this. My background is about 25 years working in corporate learning and development, working around the country, mostly working with Fortune 500, Fortune 1000 internationally based companies around engagement strategies, curriculum, learning and development kinds of tools and strategies. And then in this space, because along my path, alcoholism hit my family. It's been in my family system since I was a kid, and really progressed in my journey in my mid 40s, really kind of wreaking havoc in the biopsychosocial, all of those things being impacted. Not a clinician, but I've learned a lot in the space. But and so that threw me into recovery, threw me into treatment, threw me along a path into this world of mental health and wellness. And then through this little journey, I was looking for a way to figure out what I was going to do professionally, and integrated with this idea of recovery and service to others. And here it was. Build some build some curriculum tools for folks in substance use addiction treatment programs.
That's great to hear your background about where you were with developing curriculums and trainings, and because I'm very curious as we learn more about R1, when you were going to treatment, what stood out to you as far as the learning or the big term in our world is psychoeducation? What
Yeah.
was your takeaway as that was being implemented in places that you were experiencing the treatment?
It's such a great question. And when I first went into treatment, which was December 11th, 2011, I went into a detox program at medically monitored withdrawal program at Virginia Hospital Center in Virginia. And that moved me into an intensive outpatient program at the beginning of the year. And I'll be honest with you, Andrew, I was so new to this space. I was so in the throes of alcoholism, how that is physiologically, and I couldn't really tell you what I thought of the curriculum at that time. But it was years later, because I've been on a longer journey in the space, and a lot of time. I got a lot of time in between, but I had a binging kind of a thing I couldn't break. But then it was about a couple years later, I was in another intensive outpatient program, and that's where I kind of saw it. I really saw that it was very old school, very didactic, very, worksheets at an angle, terminology that was not relevant, and so it was kind of sticking with me, like, what's going on here?
Yeah.
Yeah.
Throughout my throughout my career as a counselor, I've gotten different training on curriculums. I've been through depends on where I've worked. There's always so I've been through ones that like have been used with like Department of Corrections. I've used ones that have been used in different settings and places. I think people forget about the importance of psychoeducation
Yeah.
and learning in this treatment space.
Yeah.
I think it often becomes a forgetful thing about, well, as a counselor, I'm here to process what you're going through, but then part of it is also educating people. on things. Have you noticed that that aspect of sort of treatment on
It,
education and learning is sometimes more at the bottom of priorities?
Yeah, I think it's a really good point. I think from the perspective of the treatment program, that's certainly with a, with a good counseling approach, right, clinical approach, using evidence-based practices. I've learned this along the path, like motivational interviewing, CBT,
Yep.
cognitive behavioral therapy, that would put psychoeducation down at a lower rank. Um, One of the things I've learned, and in the journey, I see things differently as I go down the journey. But one of the things I'm clearly seeing is when you're early in recovery, like I was, I did not have the words. I did not have a vocabulary. I did not know about these basic topics. So I had no frame of reference. I had no, and it really comes down to a vocabulary of knowledge that I can then use, relate to, and then be able to express myself using that information. I had none of that. And so and I was also participating in some other recovery type programs, and even that wasn't really psychoeducation, but you would learn words and you get, but it just took a longer process than really good structured vocabulary building kinds of curriculum. Yeah.
It's an amazing perspective because I know within this profession there are a lot of acronyms and there's some things that we can all say that CBT, MI, we can say SDOH for social determinants of health. And it's not that these things aren't important by any means, but also what does this mean to the person in front of us? What
Yeah.
is what is their takeaway when we're utilizing this or we're trying to implement this or make improvements? I think what you're bringing up is sometimes we're just not even at a same level of what we're talking about, or I'm using this language. What does this mean? And we're thinking that everyone knows because uh, this is what we do, but that's not the case.
It's not. It's so interesting. And even this is what I've also, and this comes out of some of my other background, but I see it more clearly really being in it is, and then you have a program that has multiple practitioners, counselors, peer support, and they're using different language in between their groups. And so there's not a common language even in how they're conveying it. So I sit in your group one day and I sit in Ellen's group one day and they're using different language. And so now I'm really playing catch up and still about boundaries, but everybody's using it. So it's even harder sometimes to then, then really kind of try to figure it out.
And I think that's important to learn because counselors aren't necessarily taught or trained on how to be educators. Like I think back of my schooling, my academics, I think back to all the stuff that I went through where there wasn't a lot on this is how you educate or this is how you teach. Part of it was this is how you listen. This is how you learn
Yes,
about those basic counseling skills. But there is a gap, I think, between counselors need to be able to educate, and counselors and other professionals in this space need to be able to educate and teach. But who taught us how to do that?
absolutely.
And you had
Yeah.
a big background in that.
It's a whole in coming out of professional, it's a different discipline. It's a different profession. Education is different than counseling, right? It is. And sometimes we assume that people can walk into a room and just be masterful in a group. That is facilitation skills 101 is that's a whole nother skill set that I didn't go and get a lot of education on. And so, and yet there's an expectation that I can go do that. And not that folks can't, it's just that there's not some of the basics in there around how people learn, how people process. It's not about how I like to deliver the information. It's am I going to gauge how they like to receive the information, how they can process it. Right.
Yeah, I remember like throughout my, especially earlier on, as I've done this for a little bit longer now, but I just remember earlier on, like sometimes it was here's a book and just go through the pages. And it was like that doesn't always equate to the 12 teenagers I got in this room or the 16
Absolutely.
group of men who are struggling with substance use to just well read the introduction and go through this.
Absolutely.
It's not that the knowledge wasn't there or the value wasn't there. I think there was a very significant gap between how to teach people to apply what that is, not just know what the curriculum is, but to apply it and practice it and how to use it within like that teaching, educating role versus what I'm trying to do as a counselor, which a lot of times as a counselor, I'm doing a lot more listening and doing all
Yeah, and
that. But
there's a lot of good stuff happening there. So to be doing both, it's a lift. You know, when I first started R1, and I was at least bright enough to know I was going to be going into a place that I had no experience on the clinical side, trying to bring a curriculum to clinicians, right? Hey, that's a bad, you know. So one of the things and I'm true to it still today is I'm coming at this from learning, from education, from how people process information. One of the first concepts I brought into the space was, hey, people learn different ways. Some people are visual learners, some people are kinesthetic, some people are, verbal. And so just being able to walk in with some other frameworks allowed people to go, okay, this guy's not telling us what to do. He's coming in with some different approaches, right? The other thing I did, and this is so basic, I said, hey, when you're not in a process group circle with no tables in between and it serves a purpose, hey, there's 9 different ways to set up a room that actually can enrich the space and build a better environment for experiential learning and facilitation skills, you know. And that was just those two concepts were like, okay, that's interesting, that's different, right? And they could see some value in that.
can you talk a little bit more when they're hearing R1 or R1 learning? Is there like an overview you can give audience members what that is? Because I'm trying to also give an idea of like what it was that you're trying to bring to people, especially early on as you started this. And I imagine it's different today than where it is back then. So when you had this original idea, what was it that you were wanting to bring to people and how did you even develop it into what it is today?
Yeah, well, I'm gonna try. It's hard to keep this one brief because it's been a journey, but a lot of the principles are still true today. My partner Frank Bomer has been helping shape the digital aspect of it, which was in the original idea, but just more around the data gathering part of it, the research capabilities of the data that we're gathering, because it's all based in structured content, all based in the structures of evidence-based models and theories. So that's kind of cool. But the original idea was going to be simple. We had a card deck in this other space. And so it wasn't just, hey, it's an idea of a card deck. So the R1 Learning is an education company really working to bring in evidence-based content, right, into the space with increased engagement for people to really kind of do self-discovery, reflection, internalization, and build that vocabulary so that they can express them more effectively to their clinician, to their practitioner, to their peer support provider, right? But in that, we had a card deck, and what was beautiful about cards in terms of educational tools, it was fun. It was like, hey, get some of your hands. It was lighter. It was like, okay, I get to do something in this group today versus listen, maybe there's somebody who's taken over the group, and I could, so I get to do something no matter what happened here. And then and then it was more of an assessment kind of a tool where I could dive in and learn about me and then get a little profile with these color-coded cards. It's a card-based system, both in a hands-on and also online, but it was all gamification. It came out of a career interest tool based on Holland's work around basically people's career interests that built a profile. And so it was going to take that whole idea, but then bring it into all these beautiful mental health and wellness topics, right? And the idea was this, that I would have more engagement, I would learn more, I'd build my vocabulary, and then it would be more, I could be more expressive and before I had to share. I could learn something that I could talk about, and then I had words to help me do that. But the problem that I had in my own path was when I did worksheets, I never saw them again. They were never used for any purpose with the team, so that it sent the message, well, is this really valuable or not? I mean, obviously I got value out of doing it, but it didn't play into it never showed up in my treatment plan. What was that about? And then just from a knowledge base or just understanding information, there was no learning that could come out of it at the program level or the industry level. So imagine if you could build a system that was highly structured that would be super fun for the people using it for psychoeducation, but then it could also create data that could actually be brought into the EMR, could be brought into research probably to say, hey, Tom came up with these kinds of, so it was a whole little process that was going through the mind to take this information that came out of these one-on-ones or groups and then make it usable. Yeah.
That's so important because one thing that I talk about with so many people is my my struggle is rarely when I'm with the person. Like when they're in
Yeah.
a session with me, they're there and I'm able to
You're with,
engage with
yeah,
them.
you're engaged. Yeah.
But then it's that time between sessions.
Yes.
And for some people, that could be they're seeing multiple times a week. For some people, it could be once a week. For some people, though, it could be every other week. It could be once a month. Like there can be such a gap in between when they see you again, where we do want to try to figure out how to keep supporting people. What can they take away? And I know when you say like the worksheets, it'd be like, well, here, work on this,
Yeah.
and then we'll
Yeah.
talk about it next time. And that may have been very how we had to do it
Yeah.
because how technology was and where everything in the field is. But with everything that's advanced now, there's so many more ways to continue to engage or to at least help provide
Absolutely.
support when they're not in the session.
Yeah. I mean, engagement can show up as very simple as, and we used to do this in some of the corporate work, is when we had worksheets for other documents that the corporate companies wanted to use on our platform in this other space I was in, we'd at least know if you clicked on it and you downloaded it. So, and that's a form of information around engagement. Hey, I sent you to this place. Did you even go look at it? Did you even get it? And so there's all sorts of levels of information in that. But you bring up a good point because one of the things that I come out of corporate learning and development and other kinds of educational spaces is you do pre-work. You do stuff in between the sessions, right? And some things are assigned by you to me, and then other things you say, Tom, go learn on your own, and that wasn't happening at all. There was no, here's some other things you can do on your own, and here's some things that you could do in between. It was only in the moment in my experience. Not that all programs were like that, but that was my experience.
Yeah, we're seeing that even so, where I work, we've had an app developed, and one of the
Yep,
things that we've noticed is well, it was fascinating to see sometimes how counselors react to this. But all of a sudden, a patient has access to a tool and they don't always need instruction or permission to sometimes try something. Like all of a sudden, we saw people doing these different, you know, assignments, these different skills. And I look at it and I'm like, there's no way this would have been done if I just tried to hand them a worksheet and do it in between.
exactly.
But
Right.
that's sometimes, I think this goes back to how we reach different people who learn in different styles, is believing that they have that autonomy to want to explore or want
Absolutely.
to try something that meets them where they're at in a learning style versus trying to think handing a worksheet to everyone is going to work the same. And
Yeah.
when that doesn't work, is what I hate to see, is then we challenge the person. We think they're not motivated. We think they're
Exactly.
not
Right.
ready when it's like sometimes worksheets just
It's one modality.
it's not
It's just
matches with this
it's one
person.
modality. Exactly.
But this
And
person
this
will
is a
watch
good
four
point.
videos or something on it. They'll do something
Exactly. So
else.
some people want to watch videos, some people do, and so and even our system, as much as I love it, right, because it's fun and it's one modality. In fact, I even coach some of our customers that, if you're really trying to build engagement in your populations, we're just one good tool. You should have 17 of the good, you know what I mean? It's like I come out of corporate America and companies would say they weren't looking for one vendor or one supplier. They were going to go get the best of breed across multiple providers. And I know that down the road, we're going to be one of many tools in this space. I haven't seen many new curriculum companies come into the space, not trying to invite any, but it's like, we just want to be a good one that people say, hey, in our cadre, we've got the R1 tools, and that's it's helpful for us.
Yeah, it is something
It's
that doesn't come out very often, or it's usually like I remember there's curriculum names that I've heard for so long, like thinking for a change. There's Sabisa, like there's these models that have been around for a
yeah.
long time, which also I'm interested to know too. It seems like what you've done also has had more developments and changes versus something that maybe has not been changed for several years, like updates and it sometimes seems like there's been something that's been made published and then it's set in stone and
Yeah.
it may not have anything done for a while. How do you look at when you look for like development, updating things and all that? How does that play into what you offer?
Yeah, it's a good question. We've worked really hard, and this is part of the model is to get really tried and true models and theories that have stood the test of time, like stages of change, right? There's multiple models across behavioral health. And in those, work hard to take those models and then bring content around it that's written in a very, I'll use this term, a very generic way, that are very sound behavioral statements or items that will also stand the test of time so that it can do a couple of things. One, it can cross populations. It can be used with adolescents from 13 and above. It can be used with adult women populations. You can even move it into correctional populations, schools, workplace. But writing some really sound content it takes a moment, and so that's helpful. And then over time, you get feedback and you bring it into a feedback loop. And we do. I mean, we get feedback. I mean, I had some feedback more recently on one of our topics. And somebody said, hey, it sounded more too much like this. And we looked at it and we're like, yes, some of the statements did have that bent. And we're going to go back to our reviewers and republish it, and we have the ability to do that, and we do that. So but a lot of groups don't, as you know. I mean, I still walk into rooms and go, hey, those worksheets haven't changed in 27 years, and that is challenging, right?
Yeah,
For
especially
every,
with how things have changed and substance like I look at two areas that I do a lot of work with is like substance use and gambling. Those are two
yeah,
areas that I look at as how they've changed significantly in my time. When I started counseling, fentanyl was not something that was
yeah,
even mentioned at all. The way gambling is today is incredibly different than what it was when I first started. So there are, and to be able to develop something, because I look at it, I've pulled up the website right now. I'm looking at this curriculum, and so many of these things, life skills, recovery, capital, emotional triggers, communication skills. These are all things that apply to quite a few different areas, populations.
yeah.
And I think that's what you're kind of talking about, where trying to necessarily create everything to work for everything is like then you're just going to be creating like a new
Exactly. All
deck,
this
new
awesome,
curriculum every
latest and
week.
greatest, we are very, and people will see this, and you can look at us hopefully in 10 more years and 20 more years, be way beyond Tom, but we're going to focus on fundamental topic. We're 101. We're not going to 301 in a topic. We're staying right at the bottom, right at the basics. Because that's where, I mean, I played sports. Before you get on the court and go play full court basketball, it's really a good thing to do some dribbling drills, some passing drills, some layup drills, some free throw drills, and you do a lot of, we used to call them station drills. And block and tackling, it's all the basics, and you get the fundamentals down, and then you can put them together. That's the beauty of focusing. And R1 also is really works hard. I work hard at it, is micro content. These activities take five minutes. The watching the videos, man. If we go over 2 minutes, the team goes, "What are you doing, Tom? That is way too long." And it's micro content because, we want to get people, have them reflect, have them learn, but it's not a 2 hour course. It's now how do you, is it relevant for you? What did you get out of it? How can you apply it in a little way, a baby step? Back to motivational interviewing. What's the little thing you can take? What's a baby step you could take if you've got some motivation in that area?
I think
You
that's really
know,
important for clinicians and people in this field because I've experienced it myself where the longer I've been doing it and the more I know, sometimes I forget what other people don't know. And
exactly.
if this is a person who's entering their first treatment, first counseling session, that there's so much there that can be really overwhelming or intimidating, or they even just don't know about it. But once again, if we're bringing that back to, I love the way you put it with those warm-up drills, those first little things that you do when you enter a practice for the first time, or what you do to start practice. It's a really great place to meet a lot of people early on.
Totally. I mean, I'm just agreeing with you non-verbally.
Yeah, yeah.
I am. You can, but it's so important. And boy, if there's one takeaway from anybody listening to this podcast is remember that people don't know what you know. And really we have I'm working on my own biases these days. I'm working on my own, lots of things. But one of the things that got clear to me is, right, people, they don't know what I know, or, and not saying Tom, I mean like the other person, right? And that's where fundamentals. I got a guy we work with in the tribal nations who has embraced R1 at a senior level and has brought us in across all the detention centers there. And one of the things he really appreciated about us, he goes, "This is intensive education. This is really to get the fundamentals at the beginning of the process, so then people have some knowledge, some words that they can even use in treatment. Like you can't be effective in treatment unless you have some basic vocabulary." Yeah.
One question I always want to ask is we might think we've got this great thing, this great product, this great service. You might think this is something incredible. It's gonna help a lot of people. I'm always curious, what are people who are experiencing it? What's their feedback? What are they saying by going through this? Have you been able to get any sort of kind of individual or patient client testimony or gain any kind of feedback from others as to what their experience is or what it was like for them when they go through and use this? I'm always fascinated by I want to think what we're doing is helping. It's really great. But also I want to know from the people we're serving if that's actually
Yeah.
aligning. So anything that you do or anything that you've been able to gather here as far as from that experience?
It's a great question. That's been part of the journey is having that feedback loop. And of course, our model at R1 is we're a training organization. So we don't deliver direct service, meaning we don't put peers in space, we don't put counselors in space, clinicians, right? We don't do that. We are train the trainer model, right? So we're training the practitioners to be able to deliver the curriculum in their settings to their population. Boom. Okay, so that said, that puts us further away from the end user, right? But we get to be part of that, and I get to go visit places. So there's been that anecdotal data that's been coming along the path, and I get emotional to be able to say, I've been in those back in some of the places where I started at the Psychiatric Institute of Washington, the heart of DC. It's a resource, 200, 300 bed, 100 bed SUD, 200 mental health, and I've been there on the units, doing that and seeing the feedback and getting the responses, and that's been beautiful. But along my own path, I've got lost, I don't get in those settings every day. I got a chance to go out to the California Department of Corrections has rolled us out across all the facilities in California. And I got to go in and see the peers train it and see the people, experiencing it in the yards, in the pods. And it's beautiful. I mean, the feedback has been great. But now with R1 Discover, to answer your question, we can do that. I mean, R1 Discover is emerging. And we just, I'll give you an example, and it's in the correctional facilities, but we just launched it in a large correctional jail system in California and also a large system in Arizona. And in the first week, we had 7,500 of these micro activities taken. We had 11,000 of our little 2-minute videos watched. And out of this process got all these comments that came through. People took the moment to write comments, like hundreds of them. And I mean, our team actually, I think most of us were breaking down crying because it was emotional. It was, I never saw this before. I never thought about that. This has been a challenge of mine in these little micro activities. And it's not the end of, it's not changing the world, but we are getting this little feedback loop from the end users now through the online version, which is just motivating for our team, you know,
Yeah, I think you've
motivating.
also been able to capture too one hard thing. Like we talked about this already was I give them something and do they even use it again, let alone is it effective? Well, if they're not using it, it's not going to be effective. But at least you've been
Yeah.
able to get a better idea of whether or not people are watching videos and doing all that type of stuff because of how it's been designed. Because that's a big missing piece too, is half the time it's hard to know if it's effective if
It's
someone's
effective.
not using it.
And I'm grateful. I got one of the people and he was part of my recovery um, uh, cadre when I first along my own path. Ended up also being a highly skilled, talented professional at a large consulting firm, building their digital strategy for their pricing software. Who's come on as my partner in R1 a few years into the journey, and now he's the CTO and also part of R1. But he is helping us shape what you just talked about is, hey, it's really going to be around, are people coming back again and again and again for engagement? And so we're tracking now in the online system. If a user comes in one time, do they come back again? How many times do they come back? How quickly do they come back in to take more activities and more videos? And are we, and so that's going to be a piece around, are they getting value out of our curriculum? Do they want to come back and do they want to tell other people about us as well? So we're tracking all of that just to
Yeah.
start to get some basic data around that idea.
What has
Yeah.
been what has been some feedback from the professionals, the helpers? Um, do they see it as this is a great thing that I'm adding to what I'm doing? Because I always look at too when we introduce new things, with technology nowadays, sometimes counselors, clinicians are afraid it's going to replace them, or is this going to be extra work
Another
that
thing.
they
Here's
have to do?
another thing.
Like, so yeah, what has been your takeaway or experience as far as those who are then providing this service using this curriculum? What have you heard from those who are providing those direct services?
Yeah, it's again another. Um, we're working hard right now on implementation science. How do you help the workforce? How do you really build a path so that an organization can, it's a change management process. It's basic change management to bring anything into an organization. So we're trying to get our now lens focused on that around stakeholder buy-in, better communication around rollout, what's the benefits to the organization, what's the benefits to me personally, right, and bring that down along the introduction of the new curriculum. So that's a lift in itself. But it's motivated us along the path because it's been the counselors and the practitioners that have really spurred on the journey. You know, um, I consider this a proof of concept until really just I think this year I'm shifting. It's no longer a proof of concept 7 years in because it's working and the feedback has always come from the practitioners.
Hmm.
It's them, and not that all of them love it, but I'm just saying they've seen the value in it enough to from day, to actually say we want to implement this. This will add value for the team. Um, but that really is the next lever is how do we ensure that the user, meaning the practitioner using the tools, um, feels that it's helpful for them in the work that they're doing. One of the things we're trying to do, and I'm going way too long on this answer, is save time. save time, save the documentation. So R1 Discover has the ability to, I leave that group with 8 people and I go back to the EMR and I sit down and now I can get a clinical note, a group note, and an individual note for everybody in that group that has person-generated data from our activities online on the tablets. And not that they don't still have to take a step, but boy, that's a nice lift. Save me time, get rid of some of my stress, and have increased engagement in the group. Hopefully that's something that will bring some value to that practitioner. Because I mean,
Yeah.
because they're skilled and they're passionate. You're one, right? You guys are skilled. You guys are super skilled. You know. So how does a curriculum add value?
Yeah, and you got to have that want in from clinicians too, because if they're not going to want to use it, they're the, like you said, you're not the one coming in and providing all these services directly to the clients or patients. Like this is, you need clinicians to want to have this and use it and make it think that not only is it going to be beneficial for those that they're serving, but also that this is not going to be a burden or something extra they have to do that, yes, it comes with its own uh, things you have to do with it, but also this is going to make what you do uh, improve the quality of work that you're providing.
Exactly. Andrew, I was thinking here about that knowledge piece. A lot of the people listening to this don't understand the cards. So we don't understand, we've seen them, but
Yeah,
so everybody out there, hey, if you know the stages of change, there's 5 stages. Imagine if you took that model and you built a color-coded card deck that had 5 different colors one for pre-contemplation, one for contemplation, right? Preparation, action, maintenance. You built 8 behaviors for each of those statement or each of those model categories. Now you've got a deck of cards, both online and in your hands. What that does, it allows that individual to go through that and say, is this me? Is this not me? And as they do some prioritization in that, they get these cards chosen, and when they turn them over, they're color coded. So it's a color coded profiling. It's more like an assessment. So think about it, a color coded assessment with categories. That's what the R1 learning system does, but it doesn't feel like an assessment. And Tom Karl does not like assessments. So, meaning, how do you do something for an individual where they can assess themselves, right? Observe themselves, gain some insight, get some color coded insights, and then be able to talk about them. And that really is, and so this whole idea is grounded in that. And so, the information, that assessment piece serves me, it also serves the practitioner, right? So, I just want to bring that in because I think, everybody's like, what are these cards anyway?
yeah. And we'll give them links so that they can take a look at the website and they'll get a
Yeah.
better idea of all the different stuff that's out there. I know when I see you at a conference and see you, it's noticeable. Your area stands out because it's something that draws people in. And sometimes I got to talk to you in between me talking to other people. So there's usually plenty of people wanting to learn more about it, find out about it. There is a lot of interest when I've seen you in so many different places of
Yeah.
people wanting to learn more about it and to apply it. I've usually seen some pretty high traffic around your
It's,
exhibit.
we really work hard, right? If you're saying that you're an engagement company, you better engage people the first time they look at you. So we have colors and we have visual stimulation and we have simplicity and hopefully what it does is, and this is the key, is when people see us, no matter where they see us in setting or in a conference, there's a curiosity that gets sparked. And it's that curiosity that has an individual lean in and go, what's that about? That's what we're trying to evoke in that individual, even in the settings, is wow, this is interesting. What am I learning about me? But it's that it's trying to spark that curiosity piece.
One more question before we wrap up. I'm curious with your experience overall, and then what you've done with R1. I think one of the biggest takeaways for me is getting back to that teacher educator role. and one that I've probably gotten the least amount of training, experience, knowledge with, right? Like I think there's this idea that if you're a counselor, you can do that versus helping counselors to be able to do that. From your experience and everything you've done with this, what's your best recommendation for where counselors and other helping professionals can step back into that role and once again get comfortable with being a teacher and an educator, with not thinking it from the counselor side or the therapist side, but thinking more of this is about educating someone and teaching them. Any thoughts or feedback you would have?
Again, you ask such great questions. This can come from two perspectives. One is, you could have a program that says, I'm going to have people do the counseling piece, I'm going to have people do the psychoeducation piece, and you could bring in educators to do psychoeducation independent of the counseling and not treat it as a process group, a co-group. I'm not saying to do that. I'm saying that could happen. I believe that the best process group is a little bit of psychoeducation and processing at the same time. So I would want the counselors to do what you were describing here, right? I don't know the answer to that because it is two disciplines, and unless you go back to where people are coming into the field and they bring in a strong educational component to the counseling degree, you're always going to have that challenge. Like, hey, let's do some basics on facilitation skills and some learning and develop, kinds of stuff, some basic. But that's where R1 is future is moving. I come from that, but I've waited a long time to go back to that. But R1 is going to continue with this. I've really taken that. I had to build some tools that were going to be used with the individuals. But now we're starting to bring into the curriculum set, like we're going to have tools for the practitioners around motivational interviewing, on facilitation skills. We did do one last year on trauma-informed care. Am I practicing trauma-informed care? So we're going to have tools now really focused at the practitioners around the fundamentals again, just fundamentals, right? And so then we'll have both sides of the coin, and then together, hopefully, we can improve the whole, intervention.
That's great. That's
But
so
I don't know.
important
It's
because
a whole
that's
nother path because I mean, you're there. You have people that are really good at it and people that aren't, you know?
yeah, and I think that's another thing where this happens where we don't talk about something enough. And then when it becomes more of a common thing, we sometimes forget about the basics. So like trauma-informed care used to be something that not everyone even knew about. It was some things that certain people were talking about or mentioning, but it was not where it is today, where it's like everyone's got to be trauma-informed care.
Yeah.
So then that becomes increased awareness. All of
Yes.
a sudden is this assumption that everyone knows what it is that we're all
I
up
know.
here, and then we forget about there's still a lot of the back to the basics we have to get to with something like trauma-informed care. We can't
Yeah.
assume everyone is at this level, especially the people that we are looking to help.
Absolutely. I know.
So to me, that is so important to remember. But that's where I've learned so much too. Like I've come from my father was a teacher, my brother is a teacher, that I
Yeah.
remember, always thinking about what it's like to continue, oh, school year starting, going back to the same old things. Like it's not always advancement up to this level. I
No.
forget sometimes about the part of continuing to remain at that level of early education, teaching, get to the basics. Like
Exactly.
even the pros still do
It
layup
is.
drills. They still do
A good
free
not
throws.
it
Like
is, not to go back to the sports metaphor again, but I played basketball in high school. My point guard in high school, I started with him for a couple years, ended up being an All-American point guard at Duke University. He's now the coach at Harvard. He was on his path after Duke. He was also the head coach of Michigan. But hey, along the path I went to go see, and we all taught, we were part of basketball. So we did the station drills, fundamentals, but then we were all camp counselors in high school and early college. And again, we were teaching the station drills. I went to see him in Michigan when he was the coach. And I went to his practice, and guess what? I thought, hey, these guys are now the big leagues. They were, blah, blah. You know what he was doing in practice? Station drills. You go to the good pros, they're doing station drills. It's all about the fundamentals. In fact, they even go back and relook at the fundamentals. So, R1 will never go. I mean, really, we're not going to go into, the left feet, just all the new stuff that's coming out. We're going to stay with motivational interviewing, facilitation skills, trauma, all the basics for the practitioners, and we're going to stick with the basics for the individuals. Because when I walked into treatment, I knew nothing. I didn't need those upper level courses. I just needed the fundamentals.
That's so important. And I thank you for that because it's easy to sometimes forget that as as you continue to do it, you do it longer with more people. Sometimes you just forget about that basic fundamentals. So I appreciate that big takeaway for me.
Your takeaway was my takeaway, which was I'm telling you, I'm leaning into you today, Andrew. It really was that I have to remember that they don't know what I know. And therefore, they can't express it in the way that I'm hoping they'll be able to express it to me because they don't have a vocabulary to do that. So, how do I help them get a vocabulary to be able to express? You got to go to the fundamentals. Teach them. You need to give them words around emotions and feelings. You got to give them a construct. You got to
And that
give
should be
them
exciting.
behavioral
That
statements around boundaries.
for us, that should be when someone doesn't know, we meet them where they're at. They don't have the knowledge or the education. That's where we should be like, this is what we want to be able to do. We want to be able like this should be inspiring, motivating. Like this is why I'm here to do this. If everyone knew it all,
I
that
know.
then why would they need
I
me?
know. And then we really work hard, and this is, I think, the secret sauce of R1. We want you to learn that stuff, but ready for this? And this is why you look at any of our models on our website. Who's in the middle of them? Me. So the idea is I get to learn about this stuff in the context of me. So how do these things relate to me? So it's that self-discovery, which is motivating because it's interesting for me to learn about me, and then I can go outward and use that information to express it to other people. But I can't do that until I see it for myself in the relevant, in the context of myself.
Yeah, that's amazing. All right, final takeaway for just listeners after our conversation or anything that you got going on you want them to know. What's your final take?
Final is if you want to learn anything about this stuff, definitely hit the website www.r1learning.com. We're emerging, we're evolving, we're both hands-on and online, all that good stuff around the curriculum. But I think this session, Andrew, was just delightful. Your questions were so helpful for me. And again, I think me landing with you on your insight, which it's I'm hoping that the listeners will really lean into this idea of fundamentals around learning and again how people process and I have to meet them where they are. It's not about I like visual stimulation. I like to do talk. I like to tell. It's how do they like to get the information. So kind of turning that around and saying, what can I do differently today that's going to reach more of the learners? And so having different ways, a different lens to come at that. But I appreciate being on the podcast. Love the work you do when I see you, and looking forward to seeing you on the path.
Yeah, I know we've already talked about we'll see each other soon. I think it's a short few months that we're already going to get to connect again. But I that takeaway, I couldn't have asked for anything more for people to think about that whole educating and working on those fundamentals. It's so important, and yet it can be easily forgotten in this space. But yet, that's something that we can do to meet everyone, whether they're struggling with mental health, substance use, gambling, no matter what severity it is. It's a place that we can meet all of them. So I truly value that conversation and takeaways from it. So thanks, Tom, for being on the podcast. We'll have notes and links for everyone to learn more about what you're doing, read your story, your background, and everything. But one again, thanks you for joining and having this conversation.
Thanks, Andrew.